Diakhaby of Valencia suffered an absolutely horrifying looking knee injury last night against Real Madrid. At the time of the injury, there was speculation as to whether or not it was a fracture or if there was something else going on with the knee. It looks like, as of right now, sources have confirmed that he suffered something known as a knee dislocation and he's due to miss the remainder of the season. A knee dislocation is absolutely a medical emergency, and so I want to go over the pertinent anatomy today for why it is so risky. I also want to talk about potential structures that could be injured in this injury and talk about recovery time frame. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I'll also go over that specific anatomy as well as what that person should expect when in rehab. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a knee dislocation, go ahead and comment on your experience in the comment section. We can see here on the injury replay that the player is going to fall backwards and make contact with Diakhaby's knee, and he's going to go down to the ground in obvious pain. So here I have a model of the knee joint, and so the top of the knee is formed by that thigh bone, also known as the femur bone, that's going to come down and form the top portion here. The bottom piece here is formed by the shin bone, also known as the tibia bone, which is going to form the bottom piece. And as we flip the model laterally or towards the outside, we also have the fibula bone as well. There are also four major ligaments that contribute to overall knee stability. The first one being that anterior cruciate ligament, also known as the ACL for short, located right in through here. Then as we flip the model medially or towards the inside, we have the MCL or the medial collateral ligament. Then we can flip this towards the outside and we have that lateral collateral ligament, also known as the LCL. And finally, as we flip towards the back here, we have the posterior cruciate ligament, also known as the PCL. There are also two other important structures that are located within the knee joint itself. They are, of course, the medial and lateral meniscus. When we are talking about a knee dislocation, this is going to be a disruption of the knee joint between the femur and the tibia. So as we can see here in this x-ray, they are completely out of alignment, and this is because that joint has been completely disrupted. And as I do that on this model here, you can see that as I move one of the bones forward in more of that dislocation position, that is stressing all of those major ligaments that are located within the knee. There's also an extremely important structure that goes down the back of the knee known as the popliteal artery, and this is a major reason why this is at risk for a major medical complication when one of these occurs. There is also a major nerve that's going to run down the back portion of the knee as well. So it's extremely important that when somebody is suspected to have a knee dislocation, that they go to the hospital right away because they need to rule out any sort of vascular involvement as well as any nerve involvement. Sometimes these injuries can self-reduce themselves where they'll come back into the joint alignment, or they can stay out and be reduced at the hospital. It looks like based on this picture, however, right after the injury, that it seems that his knee joint was still disrupted at the time of when he was carted off. Fractures happen to accompany about 60% of these knee dislocations, whether it be fractures of the femur and or tibia or potentially fibula as well. Because of the malalignment of the knee joint itself, this is going to place all of those knee ligaments, unfortunately, at risk for injury as well. As of right now, we don't know specifically what knee ligaments could be implicated in this case or the potential fractures, but it's important to say that, yeah, this is a multifaceted type of injury in most cases. All of these types of injuries are going to be confirmed, of course, via MRI, which is the gold standard. And this is where we're going to get into the grading system of ligament injuries. They are grades 1, 2, and 3. In a grade 1 ligament injury, this is where you're getting stretching of the affected ligament. In a grade 2, this is where you're getting partial tearing. And finally, in a grade 3, this is where you're going to get a full rupture of that affected ligament. Usually it's accompanied by a lot of knee instability and requires surgical intervention. If one or multiple of the knee stabilizing ligaments are implicated in this particular type of injury, this can greatly influence the recovery time frame, anywhere from about 6 months to about a year. So as of right now, given the fact that they're projecting that he's going to miss the remainder of the season at least, this is definitely on par with what we would see in the clinic. What Diakhaby would do in the rehab process is highly dependent on which knee ligaments are implicated and whether or not there's the presence of a fracture. So if we happen to hear any more updates regarding his advanced imaging that he's going to receive, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. So I wish Diakhaby the best of luck moving forward. It seems like like the most serious types of scenarios have been ruled out in his case regarding any sort of arterial involvement or nervous involvement, but unfortunately it's going to be a lengthy recovery time frame ahead of him. Thank you so much for tuning into my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the other videos that I've talked about in the past. Thank you so much for tuning in, and I'll see you next time.